The Department of Human Services, we currently take care of 2.6 million individuals. 1.1 million of them are children. The rest are adults. You heard earlier from the governor's office, close to 700,000 adults have come on to health care benefits as a result of Medicaid expansion. So in the earlier slides, we also saw that the number of dentists accepting Medicaid relative to other states is fairly good, but we could always improve upon that. And I can say over the last 2 to 3 years, we've seen an increase in our dental provider community, and I'm very, very happy about that. We want to encourage further participation. So where are we headed in the future? Well, the department is really headed towards value-based purchasing, where we are not going to be paying for, we do not want to pay for widgets any longer. We want to pay for outcomes. So through our managed care health choices contracts, starting in 2017, we'll increasingly over the next 3 years expect our managed care plans to really push out alternative payment models, and that does include dental care. So next year we expect them to hit 7.5% of spend, and by 2019 we want to be at 30% of spend. So from a policy standpoint, we have basically set the bar that we're not going to do business as we have done previously. We want to focus on value and not volume. We want to look at access to care. We want to look at the quality of care. But we also want to focus on what I'm going to call a public health model. A lot of what we do in Medicaid really should be more focused on public health and prevention and wellness, and really focusing on kids at a very early age. And some of that, there are barriers. There are educational barriers to parents as well as to the provider community, both pediatricians as well as dentists. So in the future, we really want to move towards rewarding for value and rewarding for outcomes. Some of our managed care plans are in the room, and again, I would challenge you, if 94% of our kids are within 15 minutes of a dentist that accepts Medicaid, then why are we at 44% of our kids getting preventive health? And why are only 60% of about 59% of our kids get any dental service, which is great. That's increased over the last 4 or 5 years. But why are we not doing better? And that is the challenge, I think, that we're all faced. What's coming up in the future? Again, we are pushing towards alternative payment models. We'll be working in 2017 with our managed care plans to implement some additional programs. We currently do have provider incentives for both dentists as well as PCPs. We pay for fluoride in the PCP office. One of the new things that we want to do for 2017 is to have a more unified provider incentive model that's really focused on rewarding dentists that provide a comprehensive episode of preventive care, and especially focused on that early those early ages. So again, we really want to push our managed care plans to work with the provider community to develop more of a preventive care model. We also want to think in terms of a broader team of who are the dental providers. It's not just the dentist, but it should really be a team approach. Again, using extenders, using hygienists, using EFTAs, looking at sites of service. Where can our kids access? You saw on the GeoMap, it's very interesting. The traditional dental office, apparently 94, 95% of our kids can get to a Medicaid dental office within 15 minutes. So we really need to work together to get those kids not just to those offices, but if there are other alternative sites of care delivery, then so be it, especially when it comes to basic preventive care. We also want to look at expanding the concept of the medical and dental home, where primary care is working much more collaboratively with the dental providers. And some of our managed care plans have headed down this pathway. It's a great opportunity to reinforce things like smoking cessation, talking about proper oral care, but also talking about diet in terms of addressing the types of solutions that kids drink that may lead to caries, but also lead to pediatric obesity. And even one of our plans, I think, is pushing the envelope to really looking at blood pressure as well as diabetes control. So I think as we have a better understanding of the oral cavity, it carries as an infectious disease process, but also there's a secondary inflammatory process that also may worsen cardiovascular conditions, especially in folks with diabetes. So I think as we move towards a more medical dental model, we really do need to come up with more innovative payment models that really work in a team-based approach. But to make that economically happen, we need to rethink how care is actually delivered, but then how is care actually paid for? And the previous speaker alluded to the fact that, well, the team did it all right, but they weren't economically viable. Well, we need to move to a new model so that team-based care focused on prevention really becomes the model of care that we want the state Medicaid program to proceed with. I'm a steward of the taxpayers' money. I want to see the best value that we can get for our kids and for our adults, and really look forward to hearing about some of the further discussion and outcomes that comes out of this conference. So again, thank you very much. I appreciate the opportunity to be here with you today, and I will challenge everyone in the room. Let's work collaboratively to come up with solutions that get us to where we want to get to: better access, better quality, and better value. Thank you.